Now we will begin today's webinar on decisions about work, accommodations, leave, disability, and retirement. My name is Madison McMahon Ward, and I am honored to introduce today's speaker, Joanna Morales. Joanna Morales is a cancer rights attorney and the co-founder and CEO of Triage Cancer. Ms. Morales has spent nearly 30 years working on behalf of individuals with cancer and has presented nearly 1,000 educational seminars on employment, insurance, healthcare, and advocacy issues. She co-authored a book on cancer rights law for the American Bar Association called Cancer Rights Law, an interdisciplinary approach. If you would like to read more about Joanna, you can feel free to do so on our website. If you have any questions for her, please type them in the Q&A box. And with that, I'd like to turn it over to Joanna.
Thank you, Madison. So today, we are going to talk about different decisions that you can make related to work. And it's very important that you understand all of your options related to work before you make any decisions, including how those decisions might impact your ability to access health insurance and other benefits, as well as how they're going to have an impact on your income and overall finances. So we're going to talk through working through treatment, taking time off, how you replace lost income, and then we'll end with understanding some key retirement issues. So when we're talking about cancer and finances, there is actually a lot of data that illustrates the impact that a cancer diagnosis can have on finances, and that includes how it can have an impact on work. So for example, we know somewhere between 24 and 94% of survivors continue working through treatment or return to work after treatment. And the reason it's such a big range is because that could greatly depend on the type of cancer and the stage of diagnosis and some other factors. So it is a wide range. But we also know some things about taking time off. And in the United States, we have limited options for doing that. 40% of all Americans are not eligible for FMLA leave. So when we immediately think about that as the solution, it's not necessarily a solution for most people. So we also know that there's an impact on finances, both while someone is in treatment, but then also years after diagnosis, it continues to have an impact on someone's finances. So to get us started today, I'd like to share Eric's situation. And Eric is 62, and he's been diagnosed with cancer and has been receiving chemotherapy treatment for about a month. And he's worked for a small public relations firm for 8 years in Michigan, earning about $65,000 a year. And he's worked through his treatment so far, but the side effects of treatment are making it difficult to work. And his side effects include fatigue, difficulty concentrating, and neuropathy in his hands. His employer doesn't know about his diagnosis, but has made some comments about his work product recently. Eric is worried that his employer might let him go because he's almost 65. And Eric has 4 weeks of vacation left and 2 weeks of sick leave. And he wants to keep working because he needs his job and the benefits, but he's wondering if he should maybe take some time off while he's in treatment. He's actually so stressed about the whole situation that he's considering just retiring early, but he doesn't know if that's a good idea or not. So what are Eric's options? So keep Aaron in mind as we talk about these topics, and we'll come back to him in a little while. Now, unfortunately, we know that when we're talking about work and a cancer diagnosis, individuals with that cancer diagnosis who are working are often battling a lot of assumptions. So they might be battling their own assumptions as an employee that they can't work and there's nothing that is available to help. Employers might have some assumptions about my employee can't work the same way anymore and there isn't anything that can help. But we also find that employees with a cancer diagnosis are also facing some assumptions made by their healthcare professionals, where their healthcare professionals are assuming that their patients can't or wouldn't want to work, so they should just go out on disability leave or retire. And our goal is to try to push all of those assumptions aside and help people understand that there are some choices to be made and that the law actually provides some options. Because the truth is that not everyone can afford to take time off work. And some people don't want to. Some people actually like their job and it grounds them and provides them a support system. So there's lots of reasons why someone might want to continue working during treatment. And there are people who are going to want to take time off or need to take time off. And then there are people who are going to be in a situation where they need to apply for disability insurance or retirement is the best option for them. So again, our goal is we want people to know all of their options so that they can pick the best option for them. Now, when we talk about employment rights, there's actually a lot of places to go for that information. There are laws that we call fair employment laws that protect people against discrimination in the workplace based on their medical condition, but also give them access to reasonable accommodations. And those laws exist at the federal level, like the Americans with Disabilities Act or the ADA, but they also exist at the state level. And it's important to understand not just what's available to you at the federal level, because sometimes those state laws are actually more protective or more applicable to your situation. There are also laws that we call leave laws, which allow you to take time off of work. And again, those exist at the federal level, like the Family and Medical Leave Act or FMLA, but they also exist at the state level and sometimes even the county and city level that provide ability to take time off work. And then if you work under an employment contract or a union bargaining agreement, those documents can provide additional information about what rights you have and the details about how to actually enforce those rights. So it's important to remember if you have those documents that you need to look at there too for information about what you have access to. And then we forget that the law just provides the bare minimum of what employers have to do. It just creates that bottom floor. There are so many employers that go above and beyond those minimum requirements and offer additional benefits. And those could be benefits like insurance, whether it's health, dental, vision insurance. It might also be a shorter long-term disability insurance policy, or it could be even a life insurance policy. Your employer's policies are also going to provide you with information on your ability to take time off of work. So in most cities and states across the country, if your employer gives you sick time, it's not because the law requires it. It's because they offer that as an employee benefit, because there's no federal requirement for employers to provide sick time to their employees. So your employer might also give you vacation time or just general paid time off called PTO. Or maybe they have a policy where your coworkers can donate their hours to you if you need to take time off work. All of those things are going to be specific to your employer. And so you need to find those policies. They're usually in some version of an employee handbook or manual or some type of policies and procedures document. But we know that not everybody works for an employer that has these policies written down. So you might need to do a little research and find the person at your place of employment who has the answers to some of these questions. And that might be the person you turn in your timesheet to. It might be the person who tells you about your health insurance benefits. So those are things that you can go and ask of someone at your place of employment. Now, before we get into the details of the laws that might apply in this circumstance, I do just want to cover a couple of concepts. There is something called at-will employment in the United States, where in most states, if you work for an employer, you do that at their will. So we call that at-will employment, where an employer could let you go at any time for any reason, except if that reason is discriminatory. And that means, are they discriminating against you based on your age or your gender or your race or your disability. And so just because you're an at-will employee doesn't mean an employer can discriminate against you based on your medical condition and let you go for that reason. Now, part-time employees are protected under fair employment laws the same way that full-time employees are. And if you're a temp employee, you're actually protected both when working for the temp agency, but also when you get placed with any employer. So you're actually doubly protected. Now, independent contractors, generally in that contract to work for an employer, you're waiving some of the protections that employees get when we're talking about employment laws. And so you have to look to those contracts to see what options you have available to you. So turning to working through treatment specifically, we're going to talk a little bit about the Americans with Disabilities Act specifically, also called the ADA. And most people are familiar with the ADA because there are accessible parking spots or bathrooms, there are ramps into buildings for individuals who use wheelchairs, but there's an entire section of the ADA called Title I, which just focuses on the employment of individuals with disabilities. And that's the section that we're going to talk about today. So when we're talking about Title I, it's actually enforced by the Equal Employment Opportunity Commission, or the EEOC, which is a federal agency. And the ADA has some requirements in order to use its protections. And the first is that you work for a private employer with 15 or more employees, or you work for a state or local government. Now, federal employees actually aren't covered by the ADA, but they are covered by the Rehabilitation Act of 1973, also referred to as the Rehab Act. And even though federal employees aren't covered by the ADA, the protections that I'm going to talk about are similar to the law as it was written in the Rehab Act. So they still apply, it's just under a different law. Now, you also have to be a qualified individual. And legally, that means an individual who can perform the essential functions of that job with or without an accommodation. Practically, that means that you're actually qualified for the job and that you can perform the key responsibilities of that job, but you're able to get help to do your job through an accommodation. And we'll come back to accommodations in just a few minutes. And then the last requirement is that you actually have a disability under the ADA's definition of disability. And it might be frustrating to realize this, but every law and program that we talk about actually has a different definition of disability. And so you have to be very specific and understand which law you're talking about and what that law's definition is. Now, the ADA defines disability as a physical or mental impairment that substantially limits one or more major life activities. So there's a few parts to that definition. The first is that you have a physical or mental impairment and it's having an effect on a major life activity. And that effect is that it's substantially limiting. So what's a major life activity? It's things that are major. So breathing, walking, talking, eating, all of those things are considered major life activities. In 2008, Congress actually amended the ADA and made it easier for someone with a cancer diagnosis to actually use the ADA's protections. And one of the ways that they did that was that they added to the list of major life activities. So they added things like concentrating and sleeping and the operation of major bodily functions, all things that are commonly substantially impacted by cancer treatment. And so it made it easier for someone with a cancer diagnosis to show that you actually have a disability under the ADA's definition. So once you show that you work for the right employer and that you're qualified and that you have a disability, there are 4 ways to actually use the ADA's protections. And the first is that you currently have that medical condition that is substantially limiting a major life activity. But it also applies when you have a history of having that medical condition. And that's very useful for someone who is done with treatment, isn't currently being substantially limited, but is looking to go back into the workplace and is concerned about being treated differently because of having that history of a cancer diagnosis. And that is enough for protection under the ADA. And then the third way really isn't about the employee at all. It's about the employer's perception of that employee. So we call this the regarded as prong of the ADA because the employer is regarding the employee as having a disability. And this is really the heart of discrimination, right? It's about what's going on in somebody else's head about you rather than what's actually going on with you. So because the employer thinks that you can't do the job in the same way, they're treating you differently because of that information. And that's enough for protection under the ADA. And then the last way is actually for caregivers. So there's a line in the ADA that says, employees who associate with an individual with a disability are protected against discrimination in the workplace. So caregivers, because of their caregiving status and how they are associating with the person with a disability, are protected against discrimination at work because of their caregiving status. Now, the ADA actually applies to all phases of the employment process. So what that means is job applicants are protected against discrimination in the same way that employees are. So through the entire employment process, you're protected against discrimination under the ADA. Now, what does the ADA do for you besides give you protection against discrimination at work? It also provides access to reasonable accommodations. But really the bottom line of the ADA's protections is that an employer can't make employment-related decisions based on your medical information. So that includes things like hiring decisions and firing and benefits and promotions and giving people assignments and job locations. So all of those employment decisions aren't supposed to take into consideration your medical condition and treat you differently because of your medical condition. So I mentioned reasonable accommodations a few times, and the legal definition of a reasonable accommodation is any change in the work environment or in the way things are customarily done that enable an individual with a disability to enjoy equal employment opportunities. So again, I know that's a mouthful, but basically it's saying any change at work that is going to help someone continue to do their job, return to work, or maybe even take time off is on the table as a reasonable accommodation. So to give you some practical examples of reasonable accommodations that come up most often in the context of a cancer diagnosis, we've grouped them into three main categories. And the first is about physical workspace. So this could include things like moving offices or using special equipment or furniture, or maybe even getting access to a closer parking spot. It might mean telecommuting. It might mean working from home as telecommuting, but it also might mean working from another location. Like if you have to be in a cancer center during the day for an appointment, maybe it's being able to attend a work meeting while you're in the waiting room. So telecommuting can mean lots of different things. It might also be working from another location than where you normally work. And that can be really important for a variety of reasons, including that if the office is really, one office has a lot of people working in that location, but the other office has fewer people working there, then that might be more amenable to social distancing and a quieter work environment, or any of the potential things that could come from working from that second location. The second category is a change in schedule And that could take lots of different forms. So it might be changing your actual schedule. So maybe you work from 7 to 3 instead of 9 to 5 because it's quieter in the morning when no one else is there. Or it could be about changing shifts. So working the graveyard shift rather than the morning shift. If you do shift work, it might also be a more flexible schedule or having additional breaks during the day. It might also just be taking time off of work as a reasonable accommodation. And then the last bucket is kind of a catch-all for everything else. So maybe there's technology that you can use that can help you continue to do your job. If you're dealing with neuropathy in your hands and you're in a job where you spend all day typing, then maybe you could use speak type software to continue to do your job. It might also be about changing a workplace policy. So for someone who works in an environment where there's a really strict dress code, but they have temperature sensitivities and they want to be able to wear a coat or a hat, it could be a change in the policy that allows them to have that adjusted dress code. It might also be about shifting job responsibilities. So for an elementary school teacher who not only teaches in class, but is also responsible for recess duty, maybe the recess duty could be shifted to somebody else because recess duty isn't necessarily an essential function of a teacher's responsibilities, where teaching in the classroom would be. So finally, it could also be about changing jobs entirely with an employer. We often call this the accommodation of last resort, because if someone isn't able to get a reasonable accommodation to stay in their current job, maybe there's another job at that place of employment where they could move to that job where they can do that job. But it's important to realize that an employer doesn't have to create a new job for you. They aren't required to do that. But it also doesn't mean that wouldn't necessarily work out. So some employers are willing to sort of modify job responsibilities and to shift things around so that someone can continue to work for that employer. When talking about reasonable accommodations, there are some important tips that people need to understand. So the first is that oftentimes employees feel like they're asking for a favor when they ask for an accommodation. And that isn't the case. If someone is eligible for reasonable accommodations, an employer has to accommodate them, unless it poses an undue hardship on the employer or it's a direct threat. But that's a pretty limited exception to the rule that an employer has to accommodate you. But those accommodations do have to be reasonable and effective. So what that means is it has to be reasonable based on your job responsibilities. So if your job responsibility is to drive the school bus and you ask your employer to telecommute, that's probably not going to be seen as reasonable because you actually have to drive the bus. But there might be other accommodations that would be reasonable, like switching schedules. So there's the ability to do the morning shift as opposed to the afternoon shift if someone feels more fatigued in the afternoon. But it does have to be effective for you based on what your needs are that are causing the need for the reasonable accommodation. So it can't just be any accommodation that gets offered to you. It has to be one that's actually effective for you. Now, even though caregivers are protected against discrimination under the ADA, they aren't entitled to reasonable accommodations. Even though we can think of lots of practical examples of where accommodations would be really useful for caregivers, it's not required under the ADA. But that doesn't necessarily mean that an employee couldn't ask for an accommodation as a caregiver, because I think sometimes what gets lost in these conversations is that employers want to keep good employees. And so if an employee approaches the employer and says, listen, I have this situation going on and I'd like to adjust my schedule, or I'd like to be able to telecommute for X, Y, and Z reasons on these days because I'd like to still be able to do my job effectively. When you propose it that way as a solution to the employer, it just makes it easier for the employer to say yes than if you're just presenting the employer with the problem and expecting the employer to provide the solution. Now, we think that reasonable accommodations and the ADA are the most underutilized tool for someone who's been diagnosed with cancer. And so it's important for us that people understand how to use them. So we have a lot of resources on accommodations and the ADA on our employment topics page of our website. Now, I mentioned that patients often feel like they're asking for a favor when asking for an accommodation, and employers often act like their employees are asking for a favor as opposed to what they are obligated to provide under the law. And so sometimes employees find themselves in a situation where they have to teach their employer about their responsibilities. The Job Accommodation Network, or JAN, is a program funded by the US Department of Labor, and their whole purpose is to help employers and employees navigate the accommodations process. And so they have a hotline that you can call, both as an employee or an employer. And every 2 years now, they do a research report based on what they found when people call them. And what they found is that consistently, more than half the time, an accommodation doesn't cost the employer anything at all. And another 40% or so of those accommodations had a one-time cost of less than $500. And the reason that employers were actually contacting JAN is because they wanted to keep a valued employee. It's also expensive for employers to hire new employees. You have to actually go through the process of searching for a new employee, hiring them, onboarding and training them. So that takes time and money and energy on the employer's part. And so they often will go above and beyond to keep a good employee. And so it's important for people to kind of keep that in mind when approaching the accommodations conversation. So when an employee asks for an accommodation, there is no specific time that they are required to do that under the law. But we generally recommend that people ask for an accommodation as soon as they realize that they need one. Because oftentimes employees with a cancer diagnosis will struggle through side effects and try to keep doing their job effectively. But unfortunately, that it is having an impact on their job performance. And if that's all the employer sees, then an employer can make employment decisions based on job performance. And so we want people to ask for accommodations before it starts to affect their job performance. There also isn't a magic way to ask for an accommodation. So you don't have to say, I'd like a reasonable accommodation under the Americans with Disabilities Act. You can just say, I was hoping that I could be able to telecommute for X, Y, and Z reason, or I would like to be able to switch offices. So an employer is supposed to know that those are requests for an accommodation, but that doesn't necessarily mean that's going to be the case, especially if you go directly to your supervisor, because supervisors often aren't trained to be able to respond to those types of requests. And so an employer might just come back with, no, you can't switch offices, or no, you can't work from home. And so that's why the Job Accommodation Network can be a useful tool in having those conversations. Because if an employer comes back and just says no, then you could go back to them and say, well, I've heard about this organization that specializes in accommodations. Maybe we could call them together and ask them some questions about what might be possible. And that way it sort of takes the burden off of the employee from being the one to have to educate the employer about what they're responsible for doing. There also isn't a specific person you ask for an accommodation. It's going to depend on whether or not your employer has a specific policy. So some employers are very specific. They might say you have to submit your request in writing to the director of HR, or they might not have any information about how you're actually supposed to ask for an accommodation. And in that case, you can choose, but you should understand that there are differences between going to a supervisor or going to HR or the person in charge, so to speak. Because if you ask your supervisor might not necessarily know what to do with that request, or they might be required to take that request to HR or a person in charge. And so understand that all requests are supposed to be kept confidential, but if you ask your supervisor, they might then have to share that information with HR or someone else in charge. But if you decide to start with HR and you say, I don't want my supervisor to be given information about my situation, the only thing that can be shared with the supervisor is that an accommodation has been granted and what that accommodation is. HR is not supposed to tell your supervisor all the details about your medical situation. That's supposed to be kept confidential. Now, when we're talking about accommodations, it isn't just one accommodation that you get. If you're experiencing multiple side effects, you might be getting different accommodations to address each one of those side effects. So you can get more than one accommodation, and your need for an accommodation might change over time. So if you have a specific need for an accommodation when you have surgery and go back to work, you then a few weeks later might start chemotherapy, and you might be experiencing different side effects. And so you might need a different accommodation then. Or if you start radiation therapy, you might have a different accommodation need there. So your needs may change over time. And when someone asks for a reasonable accommodation, it triggers what we call the interactive process. And it's basically just the process of asking for an accommodation, negotiating until you conclude or pick a final accommodation that the employer is going to give you, and then monitoring it, making sure it keeps working for you. And then if at some point it stops working for you, that you actually start that process all over again. But it is a negotiation. So I always recommend that people think through a list of potential accommodations that might be useful to them, because if they just come up with one and propose that to the employer, and the employer says, no, I don't think that's going to work because of X, Y, and Z, what else might work? If you haven't thought through some of the other options that could work for you, it makes that negotiation a little bit harder. So it's important that you have that back and forth conversation. If you go to the employer and say, I'd like a reasonable accommodation, and the employer says no and walks away, that's a violation of the interactive process, because the employer isn't engaging in that negotiation with you. They aren't having that back and forth conversation to make sure you're getting access to a reasonable and effective accommodation for you. So to summarize reasonable accommodations, there are a couple of key things that you need to do. And the first is that you have to be careful of assumptions. And those are your own assumptions, as well as the assumptions of your healthcare professionals, and maybe the assumptions of your employer. Assuming that there isn't an accommodation that's possible is a dangerous assumption. In fact, you should start from the opposite. Assume that everything is on the table, because the legal definition of a reasonable accommodation says any change. So rarely is the law that broad, where it basically says anything is possible as long as it's reasonable based on your job responsibilities, and that it's going to be effective for you. So think as broadly and creatively as possible about what's actually causing you the challenge at work and what are the potential solutions to address that challenge. Now, we often get asked, do I have to get my reasonable accommodations in writing? And the answer is no, it's not a legal requirement, but it could be very useful for lots of practical reasons. But imagine that your supervisor is someone you've worked with for a long time and is very supportive, and they say, you can have X, Y, and Z accommodation. And then next week, that supervisor gets promoted or leaves that job entirely. And then there would be no written record of the conversation that you've had with that supervisor and that you've been granted officially these accommodations. And so this happens all the time. There's plenty of case law around situations like that where that happens, and it creates a total misunderstanding about what has happened in the past. So getting it in writing can just be a useful record of what you're entitled to. Now, there is an important difference between things that your healthcare team can help you with to address side effects that you're experiencing. And that could include integrative therapies, it might be medications, it could be about ensuring that you have adequate nutrition and that you're getting exercise. And then there's also practical things that you can do to help support your needs at work. But both of those things are different from what you're actually going to ask an employer for. If you need to ask your employer for a change, that's asking for an accommodation. And all three of those steps can be very useful to helping you be successful at work. So I mentioned that the ADA as a federal law applies in all states, but only applies to private employers with 15 or more employees. Most states have a state fair employment law that is very similar to the ADA, but they can actually be more protective than the ADA. And one of the ways that they can be more protective is that they cover employers with fewer than 15 employees. So this is a chart that shows all of the state fair employment laws that actually cover smaller employers than 15. So if you work in Iowa, for example, your state fair employment law applies to private employers with 4 or more employees. So if you work for an employer that has between 4 and 15 employees in Iowa, you're actually only looking at the state fair employment law for protection rather than the ADA. So this is another good example of where you can't just know what's available at the federal level. You also have to pay attention to what's available to you at the state level, because sometimes it's only the state law that's going to provide you with protections. So turning to taking time off of work, there are also state laws, as well as some leave laws that exist at the county and city level that allow you to take time off work. So some of those state laws are actually very similar to the FMLA, where we call them state FMLA laws that cover smaller employers. Some of those laws have a broader definition of who you can actually care for under the state leave law. Some of the states have paid sick leave laws. So these are just some examples of the various laws that exist that allow people to take time off work. And we have detailed information about these laws on our chart of state laws. But at the federal level, when we're talking about taking time off work, we're really talking about the Family and Medical Leave Act, or the FMLA. And the FMLA is a federal law that is enforced by the U.S. Department of Labor's Wage and Hour Division. And the FMLA allows you to take time off work either for your own serious medical condition or as a caregiver of a spouse, a parent, or a child. Now, that's a pretty limited definition of who you can care for. So it's just spouse, parent, or child. It's not parent-in-law or grandparent or sibling. It's just spouse, parent, or child with a serious medical condition. And in order to use the FMLA's protections, you have to meet some requirements. Under the FMLA, an employee has to work for a private employer with 50 or more employees, or work for a local, state, or federal government of any size. And when we're talking about a private employer, it is a private employer with 50 or more employees who work for the employer within a 75-mile radius of where you work. So this is a really important distinction, because if you work for an employer that has multiple locations or offices, and maybe only 10 people work at your location, you can look within 75 miles and see, does your employer have multiple locations, where you get to add up all of the employees who work at those various locations to see if the FMLA applies to that employer. You also have to work for the employer for at least 12 months, and you have to have worked for that employer for in the last 12 months, 1,250 hours. So the 12-month requirement is a little bit flexible. So it doesn't have to be consecutive months, it just has to be cumulative, which means you can add them all up. So there are lots of industries where people come and go from their employer, and the FMLA allows employees to go back 7 years in their work history and add up any months that you worked for a particular employer to meet the FMLA requirement. Let's say you worked for an employer for 5 months and then you leave there, and then 3 years later, you go back and work for that employer again. After 7 months of working there, you'd actually be eligible to take FMLA leave because you get credit for the previous 5 months that you worked for the employer. But you do still have to meet the hour requirement. And the hour requirement comes out to be 24 hours a week if you worked all 52 weeks of the year. Unfortunately, you only actually get to count hours that you physically worked. You don't get to count vacation time or sick time to meet that hour requirement. So what does the FMLA actually do for you? The FMLA gives an eligible employee up to a total of 12 weeks of leave per year. So every 12 months, you get to take 12 weeks of FMLA leave. But the downside is that it's unpaid leave. And most people can't afford to take FMLA leave because most people can't afford to have no income coming in while taking that time off work. But really, the major benefit of the FMLA is that it puts you into what we call the FMLA bubble, that you're protected from losing your job because you're taking time off work. I think we forget that if we're just taking a sick day or a vacation day, or even going out on disability insurance, none of those things are about job protection. They're about money. They're about paying you for taking those days off. So by themselves, they actually provide no job protection. And if you are taking a sick day or a vacation day, or are taking a day where you're on long-term disability, that the employer isn't required to protect your job if you're in an at-will state. And that's why it's important to tap into the FMLA benefits if you want that job protection. It also provides health insurance protection. So if the employer pays for a portion or all of your health insurance coverage, they have to continue to do that while you're out on FMLA leave. They can't force you to take COBRA coverage during FMLA leave. So it not only provides the job protected leave, but it's also health insurance protected leave. We do have a lot of resources to help people understand the FMLA and how to effectively tap into it, which can be found on our website. But there is some nuance to actually using the FMLA. One of the benefits is that it's actually pretty flexible and that you can use it in smaller segments of time. So you don't have to take all 12 weeks at once. Maybe you take 2 weeks of FMLA time for surgery and recovery. And then a few weeks later, when you start chemotherapy, you are taking 1 day off a week for your chemo appointments. Or if you're starting radiation, maybe you're just taking a couple of hours off a day for your appointments, but then working the rest of the day. And you can take those hours off as FMLA time. So it can be very flexible. It can also help you for days that you're not feeling well and you're calling in sick to work, but you can use that also as FMLA time so that you're getting access to that job and health insurance protection. We have been hearing more and more that employers are requiring their employees to use their vacation time and sick time before getting access to the FMLA. And that's a problem because it's the FMLA that provides the job protection. And employers aren't supposed to be doing that. But that's different from saying that employers can require you to take your vacation and sick time and PTO time at the same time or concurrently with your FMLA leave. Because in that case, the PTO vacation sick time is what's paying you while you're taking time off. And the FMLA is providing you the job protection and the health insurance protection. Now, if your employer doesn't require that, you can request that and an employer has to give that to you. The FMLA is also flexible in that it can work with other laws and benefits. The ADA can actually work with the FMLA. So if someone has gotten to the end of their FMLA leave and they're not able to come back to work, they could potentially ask for additional time off as a reasonable accommodation under the ADA. So that's where they can work together. But there might be a situation where you actually want to use the ADA's reasonable accommodations to take time off instead of the FMLA. And there's lots of reasons that might be the case. It might be that you've already used up all of your FMLA, but it might be that you don't have access to it because you haven't yet worked for the employer for a year, or you haven't met the hour requirement. Or maybe you just don't qualify for the FMLA because you work for an employer between 15 and 50 employees, where the FMLA isn't going to apply to you, but the ADA would. So you can tap into reasonable accommodations to take time off. So this is another example of where we think the ADA is very underutilized. Most people don't think of the ADA as a way to take time off of work, but the protection is there. So if you are concerned about disclosing a cancer diagnosis at work, it's important to know that the law gives you some choices about disclosure. And we actually feel pretty strongly that people need to understand that they have options about disclosure and then make conscious decisions about what they want to disclose, when and how. And so we have some resources to help people think through those disclosure choices and how to fill out some of those medical certification forms related to reasonable accommodations and medical leave. We get asked a lot, do I have to tell my employer or a potential employer about my medical condition? And generally speaking, you aren't required to tell an employer or potential employer about your medical information. But there might be some circumstances where you need to disclose some information, even if it doesn't mean disclosing a cancer diagnosis. So if you want to be protected against discrimination under the ADA, your employer has to have some information about your medical condition, because you can't claim that you're being discriminated against based on your medical condition if they don't know about your medical condition. So it creates a bit of a catch-22 there. But if you want to ask for a reasonable accommodation or you want to ask for medical leave, in both of those circumstances, you have to share enough information about your medical condition to show why you're eligible for those things. Again, it doesn't necessarily mean that you have to disclose a cancer diagnosis. Most of the time, someone's need for an accommodation or need for medical leave are related to side effects from treatment. So those side effects are medical conditions on their own and can be talked about on medical certification forms without ever tying them back to an original cancer diagnosis. The important part about this process is that you understand you have some choices and know how to actually fill out these forms, but also that you have a conversation with your healthcare team about your preferences related to disclosure, so they know how to effectively fill out those medical certification forms. Again, we have lots of resources that talk about disclosure and how to actually to take these steps. So if you decide that you are going to take time off work, here are some things to think about and information to gather, especially if you're going to take time off work for a longer period of time. So you need to understand how much leave you're actually entitled to and which law or policy are you taking it under, so you know what your rights are. You also need to know if your employer actually requires a medical certification form and what that is and how to get your hands on it so that you can take that to your healthcare team to complete. And then you want to know if your employer pays for part or all of your health insurance premium, how you're actually going to do that while you're taking time off. Because if you don't have a paycheck and you pay a portion of your health insurance premium, how are they actually going to get that money from you if they're not giving you a paycheck while you're taking time off? So you want to have a conversation with them about how you submit your premium payments while you're on leave. The same thing if you have access to other benefits that you're responsible for paying for that come out of your paycheck. So things like vision or dental or disability insurance. You want to proactively think about how you're going to make those payments. And then if you do have disability insurance through your job and you're going to take an extended leave, how do you actually go about filing that claim and collecting those payments? And then your employer might have rules about what you can do while you're taking time off work. So if you're allowed to use your work email or your phone, or are other employees allowed to contact you for questions, they might have very specific rules about what you're going to do, what you're allowed to do while you're taking leave. So you want to find out that information ahead of time. So I mentioned a few times that we have quite a few resources on employment-related topics on our employment topics page, which includes all of our information related to employment. Today's webinar is intended to provide an overview about decisions that you can make related to work. We have lots of resources that goes into much more detail on all of these topics. So then the question becomes, if you take time off work or you leave work, how do you replace that lost income that you don't have anymore? And if you're in a situation where you are actually let go from your job, then you might be eligible for unemployment benefits at your state level. So states are the ones that provide unemployment benefits, and the details are going to be specific based on your state. So we have information about every state's unemployment benefits, both on our chart of state laws and our state resources page. We also have some information on our COVID-19 module on cancer finances because there were some additional benefits created as a result of COVID. But generally, if you choose to leave your job, you're not going to be eligible for unemployment benefits. But if you leave your job because you feel like it's not safe to remain working, you may still be eligible for unemployment benefits. You have to apply, and then you're probably going to have to provide some evidence about why you think that that was the case. Also, generally, you can't be eligible for both disability insurance and unemployment benefits. Even if every state has different rules, most states require individuals to say that they're able to work and are actively looking for work in order to qualify for unemployment. Whereas disability insurance is basically saying that you're unable to work because of your medical condition. And those two things generally contradict each other, which is why in most cases you don't qualify for both. Now, turning to disability insurance, this is the insurance that actually replaces your income because you're not working due to a medical condition. And disability insurance policies can pay from 45% of your income up to 90%. I've only once ever heard of a policy that actually replaced 100% of someone's income. But unfortunately, most people don't proactively go and buy disability insurance. And that's not great because a 20-year-old has a 1 in 4 chance of dealing with a disability at some point before retirement. And so many people have a need for disability insurance at some point during their life. But there are different types of disability insurance. There are private disability insurance plans that you can buy directly from an insurance company. But there are also plans that an employer purchases on behalf of their employee. So you're getting access to a disability insurance policy as an employee benefit. And I can't tell you the number of people over the years who told me they didn't have disability insurance at work. And I sent them back to their employee manual, and it turned out that they did, because it was just a piece of paper that they signed on their first day of work. And then they forgot all about it because the employer paid the premiums. And so they just forgot that that was a benefit that they had access to. So it's always worth double checking. Now, private disability insurance policies could be short-term policies, or they could be long-term policies. Short-term policies typically last 6 months to a year, whereas long-term disability policies are typically for medical conditions that are expected to last at least a year or longer. Now, it's often difficult for us to be able to answer questions about someone's private disability insurance plan because most plans are very different. And it depends on the company that you get your plan from and the details of that specific policy. But we always recommend that people learn a couple of key things about their own policy. So how does their policy actually define disability? Is it a very low standard of disability, or is it very high standard of disability? Are the benefits 45% or are they 90%? Do you have a waiting period where you have to be out of work before the benefits actually start? Do the payments last forever, or do they end at a particular time? So those are some key things that we recommend everybody understand about their coverage. There are also a handful of states that have state disability insurance. And by handful, I just mean 5: California, New York, New Jersey, Rhode Island, and Hawaii. And then Puerto Rico have state disability insurance benefits that employees pay into through their payroll taxes. The details of every state's plan are very different, but they're generally short-term disability plans that last between 6 months to a year. We have the details on our state resources page. And then we also have a quick guide to state disability insurance, which shares the key details of these state programs. And then that brings us to the 2 federal long-term disability programs that are run through the Social Security Administration, or SSA. And those programs are Social Security Disability Insurance, which is SSDI, and Supplemental Security Income, which is SSI. These 2 programs have the highest standard of disability in all the laws and programs that we talk about. So the Social Security Administration defines disability as a medical condition that is expected to last at least a year or longer or result in death that keeps you from being able to do your current job and really any job that you've had for the last 15 years. So that's a very high standard of disability. And while this is a federal program, it's administered at the state level through disability determination services agencies at the state level. And I mention this because we know that people have very different experiences across the country related to disability benefits. And I'm not proposing a solution for that. I'm just pointing out that you might have a very different experience than someone you know in another state or even another county, and that it shouldn't be that way because this is a federal program, but that's the reality of the situation. So we often have people say like, oh, well, my aunt had this entirely different experience in another state, and that just might be because things operate differently in that state. So it's important to be aware of that. So there are differences between SSI and SSDI. SSI is based on having a low income level and a low resource level, and that you have a disability. So that means that you have to meet those requirements in order to qualify for SSI. And everyone who qualifies for SSI gets the same base federal amount in 2022, which is $841. Now, some states add money on top of that, and those are called supplemental payments. But even California, which has one of the highest supplemental payments, the maximum that you can get in California from SSI this year is $971. So we're not talking about a huge amount more being added to the maximum federal amount. Now, sometimes because the application process can take a long time, SSI will pay back payments from the date that they approve the application back to the date that you applied. Now, SSI is tied to Medicaid, so that once you are eligible for SSI, in most states, you automatically become eligible for Medicaid. I do just want to mention something important related to SSI. In addition to the earned income that you have that's going to count as your income, they also count in-kind support and maintenance that pays for your food and shelter. So for example, if you're a young adult and you move back into your parents' house during treatment, they're going to count that free rent from your parents as income, and that's going to lower your SSI payment. Now, SSDI isn't based on your income level. It's based on the fact that you've worked and paid into the Social Security retirement system. And the maximum amount that you can get each month from SSDI this year is $3,345 in 2022. So the downside to SSDI is that there is a 5-month waiting period where you have to go 5 full months before they will actually provide you with a cash payment. But not only will SSDI pay you back payments, but they will also provide retroactive payments up to 12 months before you applied if they decide that your disability began then or before. So you could potentially be owed a lot of money once you do get your first check. Now, in the way that SSI is tied to Medicaid, SSDI is tied to Medicare, but you have to wait 24 full months of receiving SSDI benefits before you become eligible for Medicare. Now, one of the challenges related to the disability application process is that most applications are just denied. And unfortunately, the system is set up to deny people. And if people don't understand their rights to appeal that denial, they're going to lose out on benefits. And so it's very worthwhile to actually go through the appeals process because you're much more likely to be approved as you get through the process. A lot of times we get asked, do I have to hire an attorney to apply for disability benefits? And the answer is no, absolutely not. If someone is in the appeals process, then an attorney might be helpful, but is also not required. So we do have some information on how to find an SSDI attorney. And it's important to know that what an attorney can make representing you in the appeals process is actually capped under the law. And it's currently capped at $6,000. Is the most that an attorney can get paid for representing you during the appeals process. So we do have a lot of information on disability insurance as well on our disability insurance topics page, including a recorded webinar that goes into great detail on navigating the disability insurance process. So this is what it starts to look like when we pull together all of these individual puzzle pieces and see how they can work for someone. So Jane's doctor has suggested that she consider going out on disability, but she also has 3 weeks of vacation, 3 weeks of sick time. Her employer is covered by the FMLA and offers a short-term disability insurance policy that lasts up to 12 months. So what are Jane's options? So looking at the job and the health insurance protection, she can take those 12 weeks off under the FMLA. Then she could also take the first 3 weeks off using her sick time to pay her. Then she could use her 3 weeks of vacation time, and then she could tap into 6 weeks of her short-term disability policy to be able to pay her for the additional time off that she needs to be out for her treatment. So Mark has access to the same benefits, this time starting on the money side. He thinks he's going to need to be out of work for 15 weeks. So he can take the first 3 weeks as vacation time and pay him. The second 3 weeks is vacation time to pay him. And then he can tap into 9 weeks of a short-term disability policy to pay him. On the job and health insurance protection side, he can take the first 12 weeks off under the FMLA. But what does he do for the remaining 3 weeks that he thinks he's going to need to be out of work? He could potentially ask for a reasonable accommodation under the ADA to take off those additional 3 weeks. Every single one of these laws and benefits and protections can be used individually for someone, but this is what it starts to look like when you use them together to get access to the greatest protection and ensure that you're replacing those lost wages. So this gives you that perspective. Now, why would Mark and Jane use their sick time and vacation time before tapping into their short-term disability policy? This is a choice. So different employees are going to make different choices, but one of the benefits to using your sick time or vacation time or PTO time is that those all pay you at 100% of your salary rate, where your short-term disability policy might not pay you at 100% of your salary rate. So that's a way that you can tap into more money earlier rather than tapping into the short-term disability policy. I do just want to mention as a side note that there are some limited options for caregivers who need to take time off work and replace lost wages. So there are a growing number of states that provide state paid leave for caregivers. We don't yet have that at the federal level, despite the cancer community's advocacy efforts. So stay tuned on that. There might also be an option through the state Medicaid program where if the person you're caring for qualifies for Medicaid, they might be eligible for in-home support services where a family member could provide those services. Things like activities of daily living, like getting dressed or grocery shopping or home cleaning. So those might be things that a family member could get paid for by the Medicaid program for something that you might have been doing anyway as a caregiver. So it helps replace those lost wages. So turning to retirement, based on your age, you may be able to retire from work, and you might have retirement benefits that come from the Social Security Administration. It might be benefits that you have access to through a private retirement account. So things like a 401k plan or an IRA plan. You might also have access to a pension through your employer. And in fact, you might actually have access to more than one of these things based on different jobs that you've had throughout your life. It's important that you actually talk with a financial planner or an accountant to understand all of your options and how they might actually be working together. and the financial implications of those options. So if you actually start claiming those benefits all at the same time, it might actually increase your income and you might have to pay more taxes. Or is there a way to strategically order them so that you're getting the most out of each account? There might also be situations where, based on your age, you're required to start taking distributions out of those accounts, and that's going to impact your income level and then your taxes. So I am definitely not an accountant, but we do have financial planners that we can refer you to if you have questions about this. But it's important that you ask those questions and understand your benefits so you can make strategic decisions. Now, if you're on SSDI, the question becomes, what happens when you reach your full retirement age under Social Security standards? And the answer is nothing. Your disability benefits just automatically convert to retirement benefits, and the amount that you're getting each month from Social Security actually stays the same. So our goal is for people to understand all of their options and to be able to make educated decisions. One tool in that process is for you to actually look at your Social Security statement. And we used to get these mailed to us every year, and they don't do that anymore. They actually want you to go online to ssa.gov/myaccount and set up your account with the Social Security Administration. But this is actually really useful and can give you access to a lot of information. There are some steps to do that. You have to have an email in order to be able to do this. So the first step in the process might be that you actually have to set up an email account. And this infographic lays out the steps, but there's also a publication from Social Security, and the link is on this slide, that walks you through step by step how to actually do this. Once you actually get into your Social Security account, it's going to give you some key pieces of information. So it's going to tell you, do you have enough work credits to actually qualify for these benefits? So it's going to say, you have the 40 work credits that make you eligible to receive these benefits. It can also tell you exactly how much you would make if you were to qualify for SSDI this year. So you know exactly how much you would get from SSDI if you qualify. It also is going to show you information about your retirement account. So it's going to say you qualify for benefits because you have enough credits. Your full retirement age is 67, which for most people now, that's the full retirement age if you were born after 1962. And then it's going to tell you exactly how much you would get for your Social Security retirement benefit at each year. So if you retire early at 62, you're going to make a lot less than if you wait until your full retirement age at 67. And if you wait beyond 67 to retire, you actually will get more money for each month you wait to get access to those benefits. So your statement is going to tell you exactly how much you would get for each year you decide to retire. So you can make some strategic financial decisions about when you retire, and if it's a good idea for you to retire early. You also have to think about how all of these work decisions impact your access to benefits. So if you had health insurance coverage through your employer, you're going to need to understand your health insurance options and how to make choices between those health insurance options when your job ends. And you might be able to keep the same policy through COBRA or state COBRA, but you might have other options that are available to you that might be better. You also want to think about the other benefits that you have access to through work that you might want to keep. So when you're thinking about leaving work, there are a couple things to consider. So you want to know when or how you're going to get your last paycheck. You want to see if you're owed any unused vacation time that they're going to pay you out with. Are you eligible for COBRA or state COBRA? And what paperwork do you need to actually complete? can you convert those employee benefits that you have access to into an individual policy? So if you have a life insurance policy through your employer, if you want to keep that life insurance policy, you need to ask some questions about whether or not you can convert the group plan through your employer to be an individual plan where you continue to pay those benefits. And that applies to other types of insurance as well. You want to think about what retirement accounts you have through work, and can you roll over those funds into an individual retirement account? And then if you're in a situation where you're being let go, is your employer going to contest your application for unemployment benefits? So that makes it harder for you to get access to those benefits. You also want to make sure that your employer has your contact information so they can send you tax documents for the future. And you want to make sure that you're going to return any equipment that belongs to your employer. And if you need to do that, how are you transferring any personal information off of that equipment before you turn it in? And then some employers will allow you to set up an automatic response for your email account at work that provides your forwarding contact information. So those are just some other practical things to think about when you're leaving work. So returning to Eric's options, remember he works for a small public relations firm and he's thinking about asking for some accommodations that might address the side effects that are making it difficult for him to work. So if he wants to continue working, if that's his decision, then he can consider asking for those accommodations to help him keep working and doing his job effectively. If he wants to take time off of work, he could consider asking for time off under the FMLA, if that applies to his employer, and then decide if he wants to use his vacation time or sick time to get paid while he's taking time off. And if he decides that he's actually unable to work moving forward, he can make a decision about whether or not to apply for disability benefits. And if Eric is considering retiring, he can actually sign up for his My SSA account to compare what he'll get from Social Security if he does get SSDI, if he decides to retire early at 62, or if he waits to retire until his full retirement age. He also needs to understand his health insurance options until he turns 65 and can get Medicare. So Eric does have a lot of options that he can think through and pick the best option for him. So with that, I think we have a few minutes to